Before you do that, just when we are live.
It's okay. It's okay. It says it is preparing, but
Okay.
what were you?
I just want to ask Dr. Liu-Ambrose if you had any questions before we jump right in.
No, I don't think so.
Okay, wonderful. Then Max, you just give us the all clear when we're good to go.
Okay.
There is still a couple of minutes, so if it takes
Yeah.
a couple to set up, that's cool.
I really wish that it was easy to. It's easy to stream this to YouTube, but then a little bit more difficult to then put it over to the website.
Oh, right. Easy is relative.
Yeah. Okay, so removing that, we're adding this. And the YouTube video, which is going right there.
I was so nervous about my Wi-Fi today.
Mine just cut out actually for like 2 seconds. Yeah, but it usually only does that once a day, so
Safe me.
Yeah.
Mine just does what it wishes to do, and so I've got my phone on standby to hotspot myself if I need to do that.
Okay, so I'm going to hide myself, and then I'm going to mute and disable my video. So feel free to start whenever.
Are you recording on Zoom as well?
That is a record to the cloud. And we're recording. Okay.
Thanks.
So feel free to start whenever.
Okay, well, it's 5:30, so I think the show can go on the road. All right. Hi, everyone. Welcome to episode 2 of season 2 of Medicine in Motion podcast, where we talk about movement as medicine. From prevention to management in health and disease, physical activity plays a significant role. This season, we're focusing on physical activity in the context of the COVID-19 pandemic, and we'll be exploring a range of topics that will address the what, how, and why of keeping physically active during these times.
My name is Annabelle.
And I'm Swapna.
And we're MSc and MD PhD candidates from U of T. And in this episode, we discuss the topic of how the current COVID-19 pandemic affects brain structure and function, and explore possible therapeutic approaches and the potential role of physical activity.
We are super excited to host our guest today, Dr. Teresa Liu-Ambrose, who is a Canada Research Chair in Physical Activity, Mobility, and Cognitive Neuroscience from the University of British Columbia, and she received funding from the Canadian Institutes of Health Research for her research investigating the impact of COVID-19 on brain health.
She is also the director of the Aging, Mobility, and Cognitive Neuroscience Laboratory at the University of British Columbia, among many other endeavors. And if you have any questions along the way, please either post them in the forum or comments so that we can share them in the audience Q&A period. Please welcome Dr. Teresa Liu-Ambrose.
Hi, everybody. Thanks for having me.
It's our pleasure. So we will start right off with a question about the current situation in your area in terms of sort of what are the cases like, what are the lockdown measures, and what do you do to stay active during this time?
Sure. So I'm right now, obviously, in the province of British Columbia, and we have generally been doing pretty good, but we definitely are now in wave 2, in second wave, and the cases are increasing. So we're probably averaging around 700 to 800 cases per day across the province. Where I am situated in Vancouver, the cases are fairly steady, so roughly 150 or so. In terms of public health orders, restaurants are open, businesses are open, but there are restrictions actually on lots of sports and fitness activities, which is certainly needed, but obviously also poses some challenges. For myself, I remain active by basically, you guys can't see her, but I have a dog. So we go out for our regular walks and runs on a daily basis. She really doesn't let me slack off on any given day. So she's probably my primary means right now of staying active and being motivated to do so.
That's awesome. And it sounds like she's quite a nice addition in terms of, the mental wellness and physical wellness part of coping with a pandemic. So it's really great that you've got her.
Yeah, and actually there's actually some research that's already come out. As you can imagine, lots of people have been looking at the effects of COVID-19 in various aspects of health and behavior. And it actually has been shown that for those people who have a dog, they actually have been able to stay more active than those who don't have a dog. But I think it's just because the fact that there's another creature basically telling you to get up and take them elsewhere other than in front of your desk. Yeah.
Yeah. And hey, as a silver lining to the whole pandemic, the dogs of the world are probably very,
yes. Yeah, very much so. I completely agree.
And just switching gears just a little bit, could you please give us a brief overview of your research to set the stage for our conversation?
Sure. So my program focuses largely on healthy aging, and within that kind of broad umbrella, I focus on lifestyle strategies. And again, within that context, exercise. And I'm primarily focused on looking at how exercise impacts both our cognitive health, but also our physical health. Typically as measured by mobility, so how well someone can move around in their environment. I work with older adults that are at greater risk, so typically people with some degree of cognitive impairment or mobility issues.
And when you're looking at cognitive health, what measures of that would you typically be looking at?
We do a lot of standard neuropsychological testing, which is never a favorite of people. Everyone, including myself, get a little bit nervous when we're being tested for our cognitive abilities. We also do a fair amount of neuroimaging to better understand the relationship between one's performance as well as their, the health of their brain. So we look a lot at brain structure, but also how the brain functions as well.
Mm-hmm. And when you're talking about looking at the impact of exercise, is there a particular kind of exercise that you typically look at in your research, or does it run the gamut?
Yeah, that's a great question. So when I first started in this area as a new faculty, I actually purposely looked at resistance training, because at that time it actually was a type of training not really looked at within the context of brain health. The majority of the literature and research efforts within exercise and brain health is really focused on aerobic exercise. Mm-hmm. So when I first started, I kind of purposely deviated, but also from the fact that, again, my background is a physical therapist. And, we do know that there's utility in different types of exercise prescriptions, depending on the outcomes that you desire. So as a lab, we have, or I guess we're largely known to look at resistance training as a alternate type of approach for promoting brain health. But certainly across the board, across our studies, we do look at aerobic resistance as well as combined.
Cool.
Yeah, so you've touched on this a little bit, but just one of our general questions was that your research is multifaceted, as you've just explained, and you incorporate clinical, neuropsychological, and neuroimaging data. And so we're wondering how you broadly use those concepts together in your projects, and then specifically how they intersect in maybe the current work that you're doing.
Sure. Yeah. So those are all kind of main tenets in probably all my studies. So I do fundamentally believe that, to address complicated or complex questions well, you do really need to be fairly comprehensive in your approach. That said, I don't pretend that when I first started, conducting these studies that I was an expert in each of these components. So this is where, seeking advice and the expertise of others is really helpful in the whole notion of the benefits of collaboration, collaborative approaches. So within any, so I tend to specialize in randomized controlled trials where basically we look at, aim to measure the effect of a specific type of intervention, again, primarily exercise, and its effects on cognition and neuroimaging outcomes. And so it's kind of a different level approach whereby the cognitive piece primarily is our focus. And then from there, we use neuroimaging and also biomarkers to better understand more the mechanistic components. So that's how we tend to design our studies, is that, the behavior is what we aim to look for, because that typically is what matters the most to the individual. But then as, researchers and scientists, we want to know the why, and that's where all the other different strategies really provide greater insight.
Mm-hmm. And you are a Canada Research Chair in Physical Activity, Mobility, and Cognitive Neuroscience, and you're the recipient of funding specific to the benefits of exercise on the brain with respect to the COVID-19 pandemic and research on that. So what is that research specifically investigating?
Sure. Yeah, so we're very excited about this particular research, and this is and I should say this particular COVID focused research is part of the Canadian Longitudinal study on aging as well. So it's not a study that I'm doing solely on my own. And the primary purpose of this particular study funded by CHR is to assess or to determine the possible longer term effects of COVID-19 on both cognition and brain health. So when the pandemic first started, it became quite apparent that COVID-19 does have impact on the brain. People were coming in with strokes, having delirium, or potentially even acute inflammation of the brain. But then since, the start of the pandemic, and now we have people who have recovered from the infection, we're also now seeing that for those who may have mild cases of COVID-19, they're actually still complaining of things such as, kind of having brain fog, or even just having measurable changes in their cognition, even though at the time of the infection, they didn't present with really acute or frank neurological symptoms. And so the goal of our kind of COVID-19 CLSA study is to capture what is driving these more subtle cognitive changes and how long do they persist. We're using advanced neuroimaging to better understand what's happening in the brain, but again, trying to detect more what we call covert effects of COVID-19 versus really frank presentations such as a stroke.
Right. It'll be very intriguing to see what the actual impacts are at a more granular level. But before we dive further into that conversation about the potential intersection of exercise, brain health, and COVID-19, can we talk a little bit about how exercise and physical activity in general impacts brain health in terms of cognition and generally that we know of to this point?
Yeah, so I would say that currently the evidence collectively does suggest there is a strong role for both physical activity and exercise in the promotion of both your cognitive health as well as your brain health, in the sense that population studies, so large-scale population studies that follow people over time, consistently show that those who typically report higher levels of physical activity, they have a lower risk of developing dementia over time. And then in randomized controlled trials or experimental studies of exercise, what we see is that after a bout of specific exercise training, roughly, let's say 6 to 12 months, we can quantify actual changes, not only in one's cognitive performance, but actually in their brain structure or function as well, using neuroimaging. So that's the evidence we have to date. And I think what moving forward, what people are trying to better understand is, how do we refine exercise prescription to potentially maximize the benefits.
Yeah, that's pretty exciting, and something that I think is always great for us to hear more about, because typically when we think about health and exercise and physical activity, our minds might go straight to cardiovascular fitness, but it really does have an impact on the brain too.
Yeah, and I think the other piece that's really important to flag is the role of physical activity and exercise as a behavior towards the promotion of cognitive health and brain health, is that when we think about conditions such as dementia, it's not a condition that kind of just drops on you the minute you are, let's say, old, the minute you turn 65. It is a disease or a condition that really manifests probably over a 20-year period. And so, your daily behaviors and your consistent engagement in those behaviors really do impact how you will age over time. So I think that's another important piece, is that, it is about what you do on a daily basis, and doesn't have to be a really heroic efforts, in the sense that we're not all, we don't need to all be training for the Boston Marathon to really reap the benefits.
Yeah, I think that's a really important point too, because I think people can get maybe intimidated and perhaps discouraged on the same like wavelength of thinking about exercise, like I need to exercise, meaning I need to go out and I need to run every day. But it is interesting that you're saying just some consistency and maybe like going for a walk, just some to get yourself moving.
Yeah, absolutely. And I think that also very much aligns to the most current release of the physical activity guidelines, right? Which is, the main message is, any movement's better than no movement. So, it's not, again, it's not about always having to do a specific thing. Sure, if that is what motivates you, that, certainly that's a great approach for that particular individual, but the overall messaging should be that, again, any movement could potentially be beneficial, and then you accrue that over time.
Yeah, and that message makes it a lot easier to build that habit from day to day to building that into a bigger piece of your life.
Yeah, definitely. So let's dive right back into the whole COVID association between exercise and brain health. So over the past months and in episode 1 of season 2 of Medicine in Motion podcast, we've learned that COVID-19 impacts several systems in the body. And as we've stated, the brain is one of these targets. This virus belongs to a family of viruses that can have an impact on the brain. Can you tell us what that impact of these viruses could look like generally?
Yeah, well, maybe if I could just be maybe more specific to potentially COVID, the effect of COVID-19 on the brain, because that's obviously what I've been looking at a little bit more. So our current understanding of the virus is that it does impact blood vessel function and potentially clotting factors as well. And what is emerging is that within the context of people who are infected with COVID-19, they seem to be very prone to developing silent strokes. So not a frank stroke, but again, small, minuscule infarcts within the brain that typically don't present with a lot of clinical symptoms, meaning that, they don't have paralyses, they don't have slurring of speech, but there is damage in the brain. And that is very similar to sort of damage we actually see with aging, in the context that by the time you're 65, it's estimated around 70% of us will have some of these, silent lesions or strokes in our brain. And we do know that they can impact your cognitive performance. These type of silent strokes typically occur in the white matter, which we know is kind of the communication network of your brain, allows messages to travel appropriately and appropriately in terms of speed and also to the appropriate areas. And with these silent lesions, they essentially can impede the messaging or slow down the rate of transfer, which ultimately does manifest as some degree of impairment in your cognition. And so that's kind of the driving premise right now of how COVID-19 may impact one's cognition, but again, in a more subtle form.
So these silent strokes, how do you detect those in the context of COVID-19?
Through neuroimaging. So if you scan an individual, let's say using MRI and a specific sequence, they basically show up as these bright hyperintensities. And again, very usual presentation we see in older adults. And again, they are associated with cognitive impairment or even the risk of a stroke in itself. And also increases your risk of dementia. And what, again, within the context COVID-19 is that the evidence is emerging that we see more of these manifestations in those who've been infected.
Yeah. And is there a way, do you think, that exercise or physical activity and movement in general can be ameliorative with some of these symptoms?
Yeah, I do actually. So again, with exercise, we typically think of either as aerobic or resistance training. Actually, all forms of exercise in many ways have an impact on your cardiovascular and cerebrovascular function. And our own research actually has previously shown that if you do engage in exercise such as resistance training, you could reduce the progression of these silent lesions. So if we draw the evidence we already garnered from older adults in exercise and kind of transfer it to people with COVID-19 who potentially are now manifesting with similar pathologies, but perhaps regardless of age now, but as a function of infection, then perhaps, exercise training could also, again, mitigate the actual progression or consequences that's typically associated with these lesions.
Oh, that is an excellent preventative measure that can be taken.
Yeah.
It's really available to everyone in some kind of way because there's so many different ways you can get moving. We also have lots to learn about the possible impact of COVID-19, specifically on the brain, but we're wondering if you can comment on what the possible effect might be on cognitive health over the lifespan. And you've talked about it a bit already, but
Yeah.
particularly with respect to dementia.
Well, potentially, I suppose, again, if we extrapolate what we already know about the effects of these silent lesions or ischemic events, is that they are associated with increased dementia risk. They typically are associated with impaired executive functions as well. So these are your higher order cognitive abilities, so your ability to selectively attend, to make decisions and to execute them, and potentially and also to like inhibit responses and kind of make the most appropriate in lieu of your automatic response. So potentially we could see some of these manifestations over time in individuals who've been infected with COVID-19 regardless of age. And potentially also memory. There has been some reports already been kind of published whereby people who've had COVID-19, again, without acute or frank neurological symptoms, that they actually seem to have reduced attention span as well as reduced memory capacities.
Wow, so much reason to get moving as a preventative measure.
Yeah, well, we actually know that in terms of exercise, one of the domains most impacted by exercise is executive functions. So for whatever reason, these cognitive processes seems to be quite responsive to the benefits of exercise.
Keeping that in mind for sure.
Yeah, really. So this relates a little bit to this sort of general conversation about how exercise can be beneficial in this way. So could you tell us a little bit more about the Canadian Longitudinal Study on Aging and what that strives to achieve?
Sure. So the Canadian Longitudinal Study on Aging is a national study on aging. It started off in 2010. That was the baseline measurement. And its overall goal is basically to follow just roughly over 50,000 Canadians for at least 20 years. So it started off in 2010 was the baseline. And at entry, people were they were within the ages of 45 to 85. I should know this, to 85. And every 3 years, what happens is that people are being reassessed. The beauty of the CLSA is that it really does a very comprehensive assessment of a particular individual. So there's, of the 50,000, 30,000 is assessed in person. And so we measure their physical, their cognitive, there's lots of measures on psychological well-being, and measures of health, so blood pressure and DEXA scanning, so bone health as well as blood draws, which is banked for additional analyses. And so over time, what you're able to do is really gain a fairly comprehensive understanding of the process of aging, again, from a multi-faceted perspective. And so within CLSA, we're now building into this COVID-19 sub-studies to better understand how COVID-19 is impacting individuals. And again, it's quite a, I don't want to say opportunity because obviously no one wants this pandemic to occur. But if you can appreciate for everybody that we're studying now, we already have been looking at them since 2010. So we have their trajectories from before the pandemic, during the pandemic, and then how they'll be after the pandemic, because the CLSA will continue until 2033. So it's a very, it's like a very unique opportunity.
It's very comprehensive. It's interesting. And again, I almost used the word lucky, but I don't want to say lucky.
Yeah.
But to even gather all of those measures as well, to have that comprehensive picture. So what are some of your predictions for the outcome of this research? And I guess this can be addressed in terms of your predictions for what some of the patients would present like before and now again after or with the pandemic. Yeah,
I mean, I mean, obviously the best predictions that we're wrong and that everyone will be okay, actually, and we won't find too much. But I do suspect what we will see, again, based on what we know and what we know is rapidly changing. But I do suspect that for those with a confirmed COVID-19 infection, is that we probably will see more evidence of what we call cerebral small vessel disease, or compromise, again, as demonstrated by hyperintensities or microbleeds within the brain. And if those are present, we typically would expect that, we would see some deficits in the domains of executive functions and potentially memory as well. And then usually with these lesions, they are, a permanent event. And typically, again, if we use what we know currently, is that the lesion size only expands over time. And so in that instance, then I would suspect those who accrued these infarcts as a function of COVID-19 potentially over time would be at greater risk for other health outcomes such as stroke, or again, greater risk for dementia.
Yeah. Do you think that the information learned from this study might help with the treatment of COVID-19?
I think so. I think, certainly would flag the necessity of potentially screening and tracking people over time. So, again, let's say if I was one of those individuals who did acquire the infection, and let's say our study does show that potentially there is this effect, then hopefully what would be beneficial for me is that I would then now be tracked in terms of my cognitive performance over time to see how I'm doing. Because otherwise, if you don't track it, very often, until it's a fairly frank change, it's not going to be that noticeable. So perhaps it would lead to better screening or tracking, and then perhaps a better promotion of, lifestyle behaviors that we know could be of benefit, or at least mitigate some of the effects over time.
Yeah, and tracking is so important for understanding the epidemiology of this condition, but also I'm just thinking back to my own research on concussion, and just tracking is so important. So if that is one of the outcomes of this research, I think that's going to be highly useful for public health in general.
Yeah, I mean, there is a lot of speculations right now that, the consequences of COVID-19, again, not just within the context of the brain, but even just to kind of the overall human body might be fairly long-term. So, because again, we do hear that there's people who just feel chronically fatigued after the infection, even though they have recovered. So, we do need to understand the longer-term effects better, for sure.
Yeah, it's being coined as long COVID now, and it's become really part of that dialogue. So important things to keep track of, for sure.
Yeah.
And then just tracking back a little bit to, we were talking about the effect of exercise and the preventative potential of it for things like stroke and the sequelae that might be associated with COVID-19. Is there any previous information from the effects of exercise on brain health in the context of other types of infection that maybe we can think about in the context of COVID-19?
Yeah, there's actually a lot of research interest now in actually HIV and brain aging. I'm not sure if you guys, sorry, that this is the part that I was warning you about. I am unfortunately going to have to just give me 1 sec here.
Sure. The dog is being
Another highlight in every Zoom call that we have, seeing the pets, and we got a little glimpse of your dog right there.
Yeah, sorry, my daughter came home, so I just knew she wants to go see her. So anyways, other types of virus or other viruses potentially as an example. So I think HIV is a good one. There is, I would say probably in the last decade, but certainly the last 5 years, there's been lots of growing interest in looking at the effect of HIV on brain aging. And with that, there's now quite a bit of interest in looking at how lifestyle factors such as physical activity may moderate that relationship. So first, in terms of HIV and brain aging, it seems to accelerate it. So if you have been infected, you do seem to express this accelerated brain aging aspect. And what's also emerging is that, if you then add the third variable, physical activity, it seems to moderate that relationship, meaning that it lessens the impact of the infection on brain and cognitive outcomes. So assuming there potentially could be similarities, and that's where I think, exercise in itself or physical activity in itself could also potentially be a significant strategy in moderating the longer term effects of COVID-19 on cognitive health or brain health.
Yeah, that's a really positive finding to know about like viral infection in general, but the potential for that for COVID-19, because we all, I think, are looking for something positive to hold on to in this whole context.
Yeah, and I mean, the other aspects of COVID-19, and I guess it could be related to brain health, but it's just, we also know that for many who have had COVID-19, they seem to also be suffering a fair amount from mood disorders as well, so anxiety and depression, etc. And again, within that context, we also know that exercise seems to have a fairly buffering effect towards mood disorders. So I think from a multitude of reasons, I think there could be a very strong role for exercise within the context.
And that's a really good thing to know and to talk about, I think, because within the context of COVID-19, I feel like I've heard a lot of people feel the loss of power, the loss of normalcy, the loss of that routine, and knowing that exercise can play a potentially preventative role in protecting your brain health, but also giving you that bit of control and that bit of routine might be a very powerful thing to know and to remember and to continue to inject into your everyday life.
Yeah, no, I agree. And I think the other piece that might be considered too is sleep, right? So regardless of whether you've been directly impacted by COVID-19 or not, the things we hear about is people having a harder time to sleep because they are worried, they're anxious. Again, we know that not only does a regular schedule help with sleep rhythms, but we do know that exercise in itself seems to be associated with better quality of sleep. So from that perspective too, I think that's beneficial. I think we all feel a little bit better after a good night's sleep in terms of, our mood and etc. Sleep is very important from that perspective, but sleep is also critical in terms of brain health as well, right? Like chronic sleep deprivation, we know is not great for the brain. So again, all these, factors intersect with each other, but and sometimes I guess could seem complex, but at the same time seem very easy as well, because it does go back to the same point over and over again.
Yeah, and it really is all connected in that way, but that really does highlight again and again the potential for exercise and physical activity and movement in general to improve our quality of life. And it snowed recently here, and I'm very pleased that it gave me an extra opportunity for exercise to show.
Nice.
I'm keeping an eye out for that. Another question is that we were talking about aging and COVID-19 and the effect of that on the brain, but do you think that perhaps COVID-19 could have a different impact on the brain and the brain's function in the older population compared to a younger population? Is there something that we might see that's different, or perhaps even compared to a developing brain?
Yeah, that's hard to say because we don't have a lot of data, unfortunately, because I think what we typically see is that if COVID-19 is impacting an older adult, the adverse outcome is usually much more higher, the mortality rate. So I don't think there's as much, I guess, research or documentation as to what's happening. I can't comment on that. I would just suspect that it probably be more magnified in the older adult just because of assumed lower resiliency and function and capacity.
Mm-hmm, mm-hmm. Yeah, that does make sense.
Yeah, that makes sense. And another aspect of the virus is that some patients seem to experience a loss of taste and smell as a symptom of COVID.
Yeah.
Do you think there is any association between the proposed brain effects and this loss of taste and smell?
I do, just because we also know that the loss of smell particularly is also associated with dementia and also Parkinson's disease. So it is actually associated with other neurological disorders, and it's well documented well documented in that context. And I think also even with MS actually. Mm-hmm. So again, given that, I do think it is considered to be more of a neurological symptom of COVID-19 versus something completely just within the nose, if that makes any sense. If we again borrow from what we already know from other neurological disorders and its association with loss of smell.
Yeah. Yeah, and a loss of taste and smell, I think, really does have the potential to impact quality of life, which we've started to talk
Yeah.
about. So, do you think that exercise or social changes might impact people who have tested negative for COVID-19, but who have obviously still been subjected to other ramifications of the pandemic in general, like isolation, which has affected a lot of people, a decrease in motivation, perhaps, a loss of access to maybe what is their typical exercise outlet, so like a gym or a shared public space where they would engage in that kind of activity?
Yeah, so I mean, if I can just rephrase the question. So if you're asking, do I think, the whole notion of trying to remain physically active would be beneficial even for those who haven't had the infection? My answer would be yes, in the sense that I think the consequences of the pandemic extends beyond, just the infection itself. It really has imposed a fair amount of changes in people's lives. So, I mean, I'm happy to share that, I have older parents, and my mom actually lives with us, and, she's otherwise healthy. She's almost 85 years old, but prior to the pandemic, she'd be a person who's going to the Y every day, does her swim, breaststroke, very slow, but, she enjoys it. Then she goes to the sauna, steam room, chats with her friends, and goes home. And I would say that probably has kept her healthy physically and mentally for like years. Since the pandemic has hit, obviously she hasn't been able to do that. And, frankly, you can tell there's changes in her mood and even in her physical abilities. Like the way she moves around is just a little bit more awkward, for a lack of a better word. She's, she hasn't accrued any additional conditions per se, but I would also say, her latest blood work doesn't look as good as her last set of blood work. So, it is about the inability to kind of continue with some of the positive lifestyle behaviors that we know is beneficial. And when you do incrementally decrease in them, it does have an effect over time. And I think potentially even more so for those who are older. A year not being able to do what you typically do in terms of engaging with others, engaging in regular activity that you enjoy, I think can have significant impacts.
Mm-hmm.
Definitely. So in this sort of context of exercise as a guard to both physical health and brain health, in the context of COVID-19, do you think that people that have been affected by COVID themselves, that exercise can offer a sort of therapeutic approach, or do you think that that could maybe exacerbate symptoms, or how would one who has been affected kind of transition back?
Yeah, that's a good question. I think it's a balance. So, I would take the principles of rehabilitation, whereby the principle of rehab is that, you're using exercise as a way to recover the individuals to, their pre-status, but it's incremental and always kind of balanced with their symptoms and signs. So typically after COVID-19, many people do talk about reduced lung capacity and cardiovascular capacity. So obviously the exercise has to match that. But again, they're not going to regain it if they don't do any exercise either, right? So I think it is adopting a balance whereby you are challenging yourself, but you're being mindful of your symptoms and signs, and certainly get professional advice if you're not sure. There is a lot of talk about the need for increased need for allied health professionals such as OT and PT after this pandemic is over, because I think there is going to be a lot of rehabilitation that is needed for people to kind of restore themselves to their pre-infection state.
Absolutely. And I think that was a really good point about the allied health and the role that they're playing, and they're going to have to play in a post-pandemic context. For sure.
Yeah.
So switching gears a little bit, and actually not really, because we touched on a lot of this previously, but talking about the other non-physiological COVID-related questions. And we were talking about the impact of how the pandemic has changed our approach to exercise and movement for the general public. But now we want to talk about how that might have affected research, because it's our understanding that you had to pivot in the way that you've been conducting some of your research when the pandemic hit by changing up the exercise program so that your participants could complete them at home. And part of that entailed providing small exercise equipment to participants and working with them through manuals and custom-made videos and phone calls. And we hear that soon, once participants have the necessary technology available to them, you will be offering exercise classes online too, and maybe even incorporating wearable monitors to better track their exercise intensity, perhaps. So it seems like some of the participants, especially considering that the population that you do look at includes elderly people, might enjoy the at-home training. And we're wondering, how has this impacted your research at large?
Well, it's definitely made things very messy and fluid at all times. I mean, I literally just today, we were just talking about how we can pivot yet again. So so in March, when the pandemic first started, BC and the university went on a complete shutdown. And that's when we had to quickly pivot and basically figure a way out in home-based. And I would say what's interesting is that, I think if you broadly think about it, you automatically assume that you can do virtual online, Zoom, YouTube, etc. But at least with the participants we deal with, there's a good chunk of them who don't even have internet at home or don't have the most appropriate technology at home. So even though technology is fairly ubiquitous, it's not everywhere and not everyone can actually afford it. So we really had to work hard in that sense to include everybody. So that did involve things such as burning CDs and finding CD players to buy and giving them CDs, which, again, I don't think I have one CD player in my house anymore, but, when we think about these online videos, they, I think, can provide access to the majority, but not everybody. And it is something that's been discussed a lot, is that, that gap in technology use. So that was certainly a challenge that was very real to us, and we had to work very hard around it. I think we did it fairly successfully. And then we actually resumed in-person training, but then because of the second wave, we're now kind of having to do a modified version again. What I would say is most interesting is at the end of it all, most of our participants still really like the in-person training, but I think it's because there's that level of engagement. And I think we all talk about it. We were all meeting by Zoom and it gets the job done, but there is something that is a little bit lacking in connecting. And I think at least, again, I'm only speaking from the experience of my own research and working with our participants, is that, sometimes that connection is really critical as well. We can get the exercise delivered and they do it at home. But if you ask about their preferences, I think they still prefer the opportunity to be in kind of an in-person setting. The other piece we actually also had, met as a challenge is that it is about the safety as well. So we work with older adults who do have some impairment either in their cognition or their mobility. So the risk for falling while exercising at home is quite high. So we had to be careful about people looking at their, let's say, laptop or computer or their phone while trying to do the exercise and not be too distracted, because that literally is quite a divided attention task now versus being in person, being instructed, which is much more focused. So that were a lot of learning points in our transition and pivoting around COVID-19.
For sure. That's a lot of points around which to have to pivot. And I think it's very relatable, like that you had to pivot, like even with our podcast, we had to pivot to, the platform that we're using. But it does sound like you had some particular challenges that were
I mean, there were definitely insights, because again, when things first shifted, we saw a lot of kind of online YouTube, and we thought that would be the way for us to go, but we quickly realized it wasn't going to be working for us 100 or for our participants 100% of the time. So we really had to think of other ways to be 100% inclusive.
Knowing your audience.
I think it's really interesting, because your first assumption again would be that it could be very smooth with all the technology that we have. But I'm not surprised. I don't think that people enjoy the in-person. I think I would probably be the same way. But I guess along those lines, how do you think the use of technology in home programs like this will impact research in the future? Like, do you think that people may move to conducting studies remotely now that there is this system in place to do so?
Yeah, I mean, I do think that, there's going to be lots of things that will be different. So I think even beyond research and how we train people, I think even how we meet people and get things done will change after the pandemic. I do think people will be more open to the idea of remote training or remote delivery. And in some ways, one of the benefits is that then there's no boundaries now, right? So I technically could recruit people across Canada, even though I'm located at UBC. So I think there is, potential for wide capacity and wide access again. I think where I always am a bit cautious is that then we want to make sure we don't dilute, the prescription. So if the intent is to exercise at a certain intensity, if that is the intervention if that is the intervention interest, you do need to ensure that somehow you are monitoring that remotely. And again, this is where you mentioned about the wearable devices, and we are using them. Again, one of the challenges is that some of our participants find them very difficult if they have to do something extra on their end, such as push a button to start, push a button to end. Just asking to wear it is not an issue, but if they have to interface and kind of do a start or end for any components, for some that is a little bit stressful. So I think it depends on who you're working with, and then the intervention also at hand, whether it really matters, exactly the intensity they're performing at, or is it more of a general program of promoting engagement in physical activity. So that's quite different in the design and nature as well.
Mm-hmm. That technology learning curve is something that I think we're going to have to continue to think about as we incorporate the use of technology. And we talked about the impact socially, but what's your opinion on how all of this and the changes that we've talked about might impact people socially if they stop attending in-person exercise classes and instead stay at home? Again, especially considering that some of these people are elderly and may not leave their homes regularly anymore for other reasons.
I think my concern has always been the impact on their mood. And I say this because, again, is the stories we hear from our own participants, whereby and I guess just to provide a bit of context, from most of our participants, we know them quite well in the sense that we see them, again, pre-pandemic, anywhere from 2 to 4 times a week, and then up to 6 to 12 months. So we know them well. And when we had to quickly shut down, and again, essentially that ability to gather and exercise and socialize was removed, we did hear lots of stories of people feeling more depressed or more anxious. And kind of the inability to cope, even though technically there's less to deal with, if that makes any sense, right? Because now we're just staying at home. You're not having to attend classes 3 times per week. You're not having to remember to take your diaries in. But for whatever reason, that's what we heard. And I think that's where, the socialization does provide us with lots of mental support, whether we are always cognizant of it or not. And certainly for older adults, and again, I'll refer back to my own parents, typically as you age, if you have the luxury of having a longer lifespan, one of the side effects is that your own social circle typically only reduces, right? That's true for my parents as well. And so I think part of, the reasons we tend to attract participants to our research, and they end up being very dedicated to us, is that they actually end up building social circles within the context of the research program.
Yeah, that makes a lot of sense, how that would sort of become your social circle if you are seeing these people regularly, weekly. And so kind of going off of that, lots of people in the pandemic are mentioning how it's hard to keep track of what day of the week it is or how much time has passed. And me as well. And I've noticed that your participants have experienced the same thing, as you were sort of just touching on. And we saw that one participant mentioned that the different exercises and check-in calls gave her an anchor point in the day. And you added that even for people who aren't part of a research study, it can be helpful to find creative ways of exercising at home to make it a hobby. So what might be some examples of creative ways that people who maybe don't generally enjoy exercising or have it as a hobby can try to turn it into more of a hobby?
Yeah, that's a great question. If I really knew the solution to that, I think it would be widely popular. No, I think even just, so this is not just about older adults. I think it is important to build schedule during the pandemic. So for myself, for one, I don't have to commute to work now, right? And it's only recently I had to kind of remind myself, just because I'm not commuting doesn't mean I therefore should use that time to work more. And so what I've started doing is that during the time I normally would commute is actually just walk my dog instead. So it's kind of about building, I guess it's almost like what you used to do and now you can't do, but then building some structure around that activity now. So for myself, I started walking or doing something that's active with my dog during what I typically would commute. And then same thing, basically I still have an end of a work day schedule. Again, I'm lucky in the sense that my dog, I think, can tell time. By 5 o'clock, she usually will be storming to the desk and kind of barking at me saying we need to go. But I think it is about being creative and ensuring that it is timed in the sense that it works for you. And then in terms of other kind of ways of being creative, for many of our older adults, what they have shared is that they do tend to now kind of use household activities as a way of exercising. And in part, that's what we kind of shared with them. So as an example, if you're going to be doing laundry, even lifting the basket, a full laundry basket up, 10 times, that's kind of like a bicep curl. Hold the basket and sit to stand 10 times, that's kind of doing squats, but with some weights. And so those are kind of the tips we've provided to our own participants as a way of building activity into their day. Because again, we are concerned that they are much less active than they were pre-pandemic, just because, again, most of us think that we need to go to gym or some type of formal activity to gain, the benefits of exercise, even though we know all those other activities that I just described could potentially provide equal benefits.
For sure. There's a lot of scope for being creative. And I mean, with or without a pandemic, there's lots of ways to get your movement in and outside of a gym. And just continuing from that conversation about creativity, and not just thinking about older adults, but just everyone in general. How do you think that the upcoming winter will impact people's motivation to work out from home, whether that be because of the decrease in daylight hours or because it's colder and slipperier in terms of the weather, limiting their ability to go running outside or biking outside or whatever it might be? What might be some recommendations to combat this?
Yeah, so I think for like the average individual, because of the pandemic, there is no lack of online videos now. So I think in some ways, we probably have more options to work out at home, again, using technology than we ever have had before. So I know for many of my colleagues, they have now subscribed to these HIIT sessions or some type of session that really doesn't occupy a lot of space or a lot of time, and they can get their workouts. In terms of, the shorter days, I think we know that generally people are have less motivation. It's hard, right? When you wake up, it's dark, you go to bed, it's dark, and it's just kind of dark all around. It is not as easy to motivate yourself. So I think, again, this is more for the general population. Use technology as a way to motivate yourself. You certainly can work out with your friend, by the fact that you could be in sort of in the virtual space together. So the same advice we normally would provide, I think, would still apply, except now you have the benefit of technology to try to tie you in with that. I think that would be kind of my advice. Me personally, the shorter days is a challenge. So I actually tend to start my work day earlier because it's going to be dark anyways. And I try to end my day a little bit earlier so I can catch the end of the day where it's still a little bit bright, and I go out and get my activity in if the outdoors kind of your choice, and it is my preference for sure to be outdoors versus in an enclosed space.
Yeah, that's some really good advice. Thanks.
Yeah, for sure. And I find the same thing. I prefer to be outdoors, especially now when we have to be inside so much of the time. Yeah. But with the winter, it can get hard. But if you do have that time, what maybe would be your commuting time, I think that was a great point, that would be at the end of the day anyways. So you can just sort of transition to an outdoor space. So yeah, I think that's great advice. Sorry, go ahead.
Oh, no, no, that's all good.
Yeah.
In terms of outdoors in Toronto, I think most of the outdoor rinks are now open, and that's like hockey.
Oh,
and
nice.
my thing for my preference for exercise. So I know I'm going to be signing up for that, because now we have to register in order to make sure that there's only so many people, I think 25 at a rink at a given time. But yeah, there are opportunities for exercise outdoors, even in the winter.
That's true. Just keep your eyes open for it. So now let's turn it over to you, the audience. We will ask a few of your questions.
And the audience has sent in some questions, which is exciting. So the first one is, Dr. Liu-Ambrose, you've mentioned your early work focusing on the effects of resistance training on the brain. Could you comment on the difference compared to aerobic or more cardiovascular-based exercise? Thank you to whoever sent that question in.
Yeah, so we found a fairly similar effects in terms of cognitive outcomes. So what we have found is that resistance training seems to promote executive functions kind of fairly effectively, and then secondarily memory. And that's what we typically see with aerobic exercise as well. And certainly there's been, very good systematic reviews coming out now showing very similar things, such as the Northey by Northey that was published in the British Journal of Sports Medicine. Where we potentially are seeing some differences is actually in the neuroimaging outcomes. So one of my interests in neuroimaging and exercise and cognitive aging is actually related to cerebral small vessel disease. And as I shared on the podcast already, is that we did find that resistance training seems to mitigate the progression of lesions within the white matter. But we haven't found that with aerobic exercise, though. So it's kind of interesting to us as to why that is, given that aerobic exercise is supposedly to have, fairly good impact on cardiovascular and cerebrovascular function. So that's something we're pursuing a little bit more to better understand. But from a cognitive performance piece, we see fairly similar. With aerobic exercise, in terms of brain structure, there's more evidence for it to promote the hippocampal volume. So we've shown that, as well as Kirk Erickson and Art Kramer's group. While with resistance training, I don't think there's as much evidence to suggest that. So there might be some differences in how it impacts, let's say, brain function and brain structure, but kind of ending with fairly similar endpoints in terms of cognitive performance.
That's intriguing, the potential difference between aerobic and anaerobic exercise. And it's just not something that I really expected, but very interesting.
Yeah, I agree. I didn't necessarily expect it, but I guess that's more incentive to incorporate both styles.
Yeah.
So a second question is, in a previous episode of this podcast, we learned that brain-derived neurotrophic factor, aka BDNF, is released in response to exercise and promotes brain growth. Is this one of the markers you measure in your studies? And could this possibly be beneficial against a COVID infection?
Yeah, so BDNF is definitely one of the key neurotrophic factors that's hypothesized in how exercise, particularly aerobic exercise, brings about benefits to cognitive function and impacts the brain. So in terms of, but what is less known is whether all types of exercise tends to increase BDNF, if that makes any sense. So one of the hypotheses actually in terms of the neurobiology of different types of exercise is that potentially aerobic exercise seems to go down the BDNF path. And for the resistance training, it might be more on the IGF pathway. We're not sure, but there is some suggestion from animal models regarding that. In human models, one of the challenges, and we do measure it in human or in our trials, and we have shown that it does increase with aerobic exercise as hypothesized, but more so in females than in males. So I'm kind of bringing up another piece that's being studied or pursued within exercise neuroscience is understanding sex differences and the efficacy of exercise in terms of cognitive and brain outcomes. But the challenge of BDNF within human studies, again, is that we're measuring peripheral levels, right? So the peripheral levels in itself may not or likely does not reflect the central level. So we're always inferring. And if you actually look at the collective literature within human studies, it kind of goes either way. It can sometimes increase, sometimes decrease with exercise. And I think it partially is because the fact that we're measuring peripheral levels, and it probably has some type of timing effect too, as to when exercise was last done, how long the exercise was for. So it's not as clear cut, to be quite honest. It's very clear in animal models, but in humans is less clear. But I think, again, is how we're measuring it as well.
Yeah, that makes a lot of sense. There is a follow-up question as well regarding what are some of the other markers that you measure?
In terms of other neurotrophic factors, we also measure IGF-1 because, again, we are quite interested in resistance training, and it is hypothesized that resistance training would increase the IGF pathway a little bit more. We're also quite interested in looking at inflammatory markers because, again, one of the hypothesized pathways by which exercise benefits the brain, but also really health in general, is by reducing systemic inflammation. And we know inflammation really in any capacity is not beneficial for health outcomes. So we do look at multiple markers of inflammation. We're collecting it right now. And then we do look at things that's related more to cardiometabolic health, such as homocysteine, as well as hemoglobin A1C, which is, kind of indicative of how well you're regulating insulin. Because again, these all do matter in terms of how your brain metabolizes sugars and etc. So those are some of our, I think, main biomarkers that we've been collecting.
That's really
cortisol. Oh, sorry, and cortisol from saliva as well.
It's a nice broad spectrum of markers that you're collecting. So it sounds like the picture that you're going to get at the end of this is going to be quite comprehensive.
Hopefully, yes. But again, in some ways, we'll see because again, everyone does vary a lot. So that's why you do need a fairly good sample before you get some consistency in the variability of these biomarkers. Yeah.
Yeah, very much so. And we have a couple more questions from the audience that we have a bit of time to get to before we close out. Okay. And the next one says, Dr. Liu-Ambrose mentioned that her longitudinal study that will be completed around 2033. How can people follow up with the results of that study, including the COVID-specific effects?
Yeah. So just to clarify, it's not my study. So this is part of a national study called the CLSA, which again is aiming to complete by 2033. There's many papers on the CLSA that's being currently published. It is a national database. And so actually, but for anyone who's interested in accessing that data, it is available to individuals who just really apply. And if you are a research trainee, like a master's, PhD, or postdoc, you actually can access it. And again, don't quote me on this, but I believe the policy is that if it is related to your thesis work, you can actually access it for free. Otherwise, for myself as an investigator, I would pay $3,000 to access it after proposing a specific question. So that's kind of like data access piece. But so there's kind of findings from the CLSE that's coming out as we speak, because people are going into the database, addressing different questions and publishing on them. In regards to COVID, we are hoping we'll be able to have results within, like after 2 years of finishing. So we have to finish the study first. So this year is going to be a very busy year for us to gather the neuroimaging data as well as the cognitive data. And then we hope to share that data as well as the results kind of at a national level. And then perhaps over time, there'll be more longitudinal results to share as well.
Great. That's great. It's good news as a master's student to know that.
Yeah. Yeah, you should look it up for sure. Yeah, it's a very rich data set. And and it's prospective data that's available now as well. So
that's very interesting. Awesome. So the next question begins, I like hearing about the beneficial effects of exercise on the brain. What is the minimum amount of exercise I need to perform to get some of these benefits?
Yeah. Yes, of course. So I can't really comment that we know absolutely that there's the minimal dose. And I do think it depends on the individual. So if you are a person who's completely sedentary, I would say even if you got up and went for a brisk walk for 20 minutes, you probably will get some benefits. And I think all of us can relate to that, right? Sometimes even if you're stuck on writing a sentence, you go for a walk, you come back, you feel better, you think more clearly. There is acute benefits of exercise already. But I think like most things, to incrementally, gain, you probably need to incrementally increase some degree. But I think that minimal dose really depends on the individual. Because again, even from what we know with research within people with dementia, like very light exercise, even just movement, coordinated movement in itself seems to provide some cognitive benefits.
Mm-hmm. Well, with that, I think we'd like to say thank you so much to our rockstar guest, Dr. Teresa Liu-Ambrose, for providing an overview of her really exciting research and insights into the potential intersection of COVID-19, brain health, and exercise. And if you'd like to follow her research journey, you can follow the Twitter handle at UBC_CogMobLab. We'll link that in the description. And thank you to you, our audience, for your questions that made for quite the engaging discussion.
If you'd like to continue the discussion, please head over to our website, medicineinmotionpodcast.ca/live, and check out our discussion forum. If you would like to listen to this episode again or share it with your friends, you can find a recording of today's conversation in podcast form by searching Medicine in Motion on iTunes, Spotify, and Google Podcasts.
And we want to thank you for tuning in. As always, we love to hear what you think. Find us on Instagram, Facebook, and YouTube at Medicine in Motion Podcast, and connect, follow, like, and subscribe. And until next time, remember, exercise is the best medicine. And a big thank you again to Dr. Liu-Ambrose. Thank you so much for joining us.
Oh, you're welcome.